All right, I'm here on the Danbury Green with Congressman Murphy. This is the second day you've been out here, and I know you've been around the 5th District talking to people. I saw you in Simsbury, which was somewhat interesting. And I just want to get your feelings about meeting the people and talking to the residents in the 5th District about health care.
You know, there are some members of Congress out there who are hiding, who don't want to be out here and talk to folks about health care. I've taken the exact opposite approach. This is my second day of spending 2 hours down here on the Danbury Town Green talking to anybody who wants to talk to me. I was at Waterbury Town Green on Tuesday. I'll be back there again on Friday. Last night we did 2 hours up at Shippog High School. I am losing my voice if you can hear it, but this is the job. I mean, I don't vote how Chris Murphy says that I should vote. I vote how my constituents want me to vote. There's a lot of passion on both sides of this debate. A lot of people that are concerned that they would lose their insurance that they have now. My job is to try to tell them that that's not in the plan, that our intention is if you want insurance to keep it. A lot of people out there who don't understand how insurance companies have gotten away with what they've gotten away with and really want health care reform because they think that it's going to start to rein in some of the worst abuses of the insurance industry. My job is to tell people that that really is my mission when I go back down to Washington to try to push for that kind of insurance reform. There's a lot of great input, a lot of great ideas that I'm getting out here, and I don't know how to do my job any other way.
All right. Now, I've been, like I said, I've been to a few of these meetings with you, and I hear a lot of weird things like death panels, and people are going to be forced into public option. It's going to create a single-payer system. How do you handle the misinformation that's being levied out there and being directed towards congressmen like you?
Yeah, it's tough. I mean, you know, we heard today and yesterday, you know, people believing that the Weather Underground is writing the health care bill. And, you know, I think somebody asked a very good question at the end of the conversation today. How do you get your information and make sure that it's right? And I said one of the first things I do is I don't pay attention to anybody who's on the cable news shows from 8 o'clock to 11 o'clock. Those people are entertainers. They're not healthcare experts. They have an agenda. And if you hear anything on those news shows, and, you know, frankly, whether it's MSNBC or Fox News, you got to go and verify it. You got to go and make sure that that isn't just somebody spinning a rumor to spin a rumor, because a lot of what I'm hearing just isn't in the bill. And I'm hopeful that people will call our office if they have a concern or rumor that they've heard. Call us and we'll walk people through this bill or whatever new draft comes out to talk about what's real and what's not.
Okay. One last question, real quick. As a progressive, I know that the Democratic residents have made it so that the Democrats have control of Congress, and now we have a Democratic president. A lot of people voted members of Congress in because they want health care reform and they want a public option. So my question to you is, how do you feel about the public option, and would you vote for a health care bill that would not have a public option in it?
I haven't set any lines in the sand for things I agree with or don't agree with on the health care bill, but I don't see any other way to try to rein in insurance costs without the public option. I'm a big supporter of it because I believe, one, that people should have the choice to be on public insurance or private insurance, depending on what's best for them. But I also agree with the Congressional Budget Office, the nonpartisan analysts in Washington that have said that the public option will save the healthcare system $100 billion because it will provide pressure on the private for-profit insurers to bring their costs down and their premiums down. So I'm a big supporter of the public option because I think that people should have the choice. This is a nation of individual responsibility and individual choice, and I think that they should make that decision themselves, and that I think that the public option can really do a great job of bringing down the cost of healthcare.
Well, thanks a lot for being here. I don't recall Nancy Johnson being out here with these type of events like this, and she was voting for health care, so from somebody who lives in the 5th, I really appreciate it.
Every one of these I schedule for an hour and it goes 2 hours. I schedule for an hour and a half, it goes 3 hours. I'm going to stick around until everybody's questions answered.
All right, thanks a lot. Appreciate it.
Great.